everyone. Welcome to the conversation with Dr. Etches for parents of children who are attending licensed childcare, both licensed group and home childcare in Ottawa. This is a wonderful opportunity for us to have a very detailed conversation. We're very excited around the number of questions that we've received directly from parents. I think we're going to keep you on your toes tonight, Dr. Etches. Parents have put a lot of thought into the questions. My name is Kim Hiscott. I'm the Executive Director of Andrew Fleck Children's Services, but this event is hosted on behalf of all parents who are attending licensed childcare across the city of Ottawa. And so all of our questions and answers so far will be in English because we didn't happen to receive any questions in French. So I'm going to start actually by asking you, Dr. Etches, if you have a few opening remarks.
I would like to say thank you for this opportunity. I really do appreciate the chance to hear what kinds of questions parents have, what kinds of concerns. It is something I can take back to the team and make sure that we're working to address those questions in other ways. Aussi, c'est vraiment important de reconnaître tout le travail des personnes dans cet secteur. It's really incredible. Everyone, is under stress and strain because of the COVID pandemic, and it's been 8 months. And so I need to say thank you also for continuing to look after each other, to look after children. And, when it comes specifically to childcare, it's so important. I think we saw that with the beginning of the pandemic when it wasn't available, and how much parents, reported that they missed that they needed that. It is one of our top goals, to continue to enable childcare to operate. So I'm sure we'll talk more about that, but, I wanted to note that in this work through this pandemic, we've actually been working more than ever with the City of Ottawa's Children's Services Department and early learning centers, childcare partners, again, both group and home care, licensed home care, licensed group. It really does take all of us learning and adapting to the new way we need to live with this virus here. And parents are key. You're doing your part to prevent COVID transmission outside of childcare, and then doing the screening, staying home when you're sick. That's not easy. And with mild symptoms with COVID, having to stay home until you make sure it's not COVID or it's not getting worse. Again, I'm happy to speak to in more detail these screening for symptoms, questions around that, because things have changed. But all the latest information, as things continue to change, is on the Ottawa Public Health website. Please just know that we continuously update that information for parents. C'est dans 2 langues et plus. L'outil pour le dépistage chaque jour, c'est dans beaucoup différentes langues. So use our website. There are resources in many different languages, especially that screening tool, which is a key part of the contribution of parents to keep COVID out of childcare settings. We do know that it's made a difference to be able to have just if your child only has one symptom that's not fever or shortness of breath or cough. That one symptom really means we should make sure it's not COVID with a test. But if it's something in the other category, like a runny nose, we know just the number of times children have runny noses, it's not usually COVID, although it can be. We know that it's made a difference to be able to have more continuity of childcare and work and all of those things. So certainly, again, that makes a difference. It's made it easier also for people to access testing. I just wanted to note that the testing access is really much improved. Now you can make an appointment to have your child tested at the CHIO Assessment Center, either by phone or online. And there's usually appointments available every day now. And the turnaround time to get those results has also improved. So that will also make life easier. I know it was a terrible struggle for a while there. So again, happy to hear the questions. Want to thank all of the child care providers, the early childhood educators, home child care providers. Your work is so critical. I think that has been underlined. And again, we want to uphold childcare services, keep them open for everyone. So I'm happy just to turn right over to questions and carry on. So thank you.
Great. Thank you. Thank you very much. I wanted to just echo a couple pieces that you said. For sure, the Children's Services have been an extremely supportive partnership to all of us through all of Children's Services that are providing care in the community. So we very much appreciate everything that they've been doing, as well as Ottawa Public Health. We know that it's been quite a learning journey for all of us, and so thank you very much for everything that you've done. And we even have, I shouldn't say even, not surprising, we have lots of compliments from parents as well. So when they were providing questions, they also wanted to add some compliments to their narrative. So for example, one of our parents said, "Thank you for all that you do. Until the most recent difficulties in securing COVID tests, I thought all levels of government have been handling the COVID-19 crisis as well as could be expected in such an unprecedented scenario. I am confident that the 3 levels of government will figure out a way to manage testing in the coming weeks. Thank you for all you do." And that's happened. The testing has definitely improved. So here's our first question. This came from a preschool parent. And so the question is, there are a number of articles and rumors circulating about how children are less contagious or less susceptible to infections than adults. And are you aware of any reports that confirm this? And really, how serious is COVID in preschoolers?
Thank you for the question. We know in the early days of the pandemic, testing wasn't as widely available, and children weren't presenting with more severe symptoms. And so we're also, for that reason, less likely to be tested. And so we really lacked a lot of data about COVID in children, but it definitely pointed to children having more mild illness. And that's been borne out. It appears to be quite rare that children have more severe illness. Hospitalizations are very rare. We have not had a hospitalization under the teenage years in Ottawa, and teenagers, it's been rare. So that's good news. We do know children with underlying chronic conditions are at higher risk, as well as infants, infants under 1 year. But there's encouraging signs that it does appear that it also, there's not a lot of evidence that pregnant mothers pass on the virus to their newborns. So when I think the question was also about spreading, and do children spread the virus even though they don't get severe symptoms? And I would say that we are getting more data about children who test positive and what happens with transmission. We're doing this because of the testing related to childcare and screening that happens in that childcare settings, as well as schools. And so we are seeing that transmission is possible. Children can pass on COVID to others, and we do see that the older children, it's more like adults in terms of the frequency that there's transmission. And we see outbreaks at all ages. So we've seen outbreaks in childcare, we've seen outbreaks in schools, both elementary and older. So it's why we recommend really everybody needs to take precaution, right? We need to actually keep distance as much as possible, from others, children as well. And of course, young children are not able to wear masks, but for older children, we do recommend they wear masks as well, because they can pass the virus on. So I think we'll continue to study this. We'll continue to look at the research around the world. But I think we know they're not, they are able to pass on COVID. It does look, and we know for sure that the symptoms are likely to be more mild. That's the bottom line.
Thank you. That's probably very reassuring for parents to hear that it be more mild. So then our next question is actually very interesting. So this parent of a toddler is asking, if their child should get COVID, what steps could they take to protect themselves as parents from becoming infected? And how do we balance the need to care for our child while preventing further infections? And then additional parents had asked, how likely is it a child would get COVID in a daycare? And how likely is it for a child to transmit COVID to older siblings and or to parents?
Thank you. The idea of preventing transmission in a household is important. We do see, of all of the people who've tested positive in Ottawa, the biggest risk factor is that someone else in your house has tested positive and it's spread within the household. So we know that's exactly the type of close contact, without a mask, that leads to higher risk of transmission. And so with a parent looking after a child, it's even harder because we know children are close contact, they need to be comforted, and yet there still are measures that parents can take. And when a child tests positive for COVID, there will be a nurse that will walk through all of the steps that need to happen. And they will counsel parents about the things they can do in the home to decrease transmission. It may be, if there's more than one caregiver in the home, that you want to restrict care to one person and keep others at a distance. You certainly can add protection if you're wearing a face shield and a medical grade mask, or even a cloth mask provides some protection. Again, I recognize young children are not going to be able to do that themselves as well, but if they could tolerate a mask, if that's something that's normal for them in your house, then that's an additional barrier. Same old with hand washing, keeping hands clean. We know this is pretty hard, and so one of the things Ottawa Public Health is working on right now is an isolation center. We want to stand up an option for families where it's too hard to isolate in the home, so that potentially a caregiver could stay with the child in a different setting, and that would provide more distance within the home to prevent transmission to others. So the questions about how likely, again, I don't have quantitative information. I'm sure, all the retrospective studies will give us better data, but what we know is it's more likely for a child to encounter COVID. Right now, we're seeing that from a household member than in a childcare setting. So more often when we see a child testing positive, their exposure has been in the home, not in a childcare center. But the risk goes up of encountering the virus in a childcare center the more contacts there are, right? The more close contacts. So the more children in the center, then the risk will increase. And it is reflective of what's out there in the community. So to decrease the risk of children getting COVID in a childcare center, we need to decrease the COVID in the community. And again, thank you for taking those steps to do that. When I think the other question was about siblings and in a household, and again, it does depend on how much distance you can put between the child who's tested positive and the other siblings. If you can keep 2 meters and use a mask and keep even if people have the luxury of a separate bathroom, use those kinds of things will decrease the risk of transmission. And again, our nurses will help, walk through some of the steps that could help.
That's great, thank you. And of course, hand washing, can't be overemphasized. And what was very interesting when we joined, when we started offering emergency childcare, it was to essential workers, and we were really impressed with how great even the very youngest of children were already at washing their hands. So it is something that young children can adapt. I'd like to just apologize a little bit. We had experienced some technical difficulties. The intention was for this to be a live presentation, and we were going to be able to offer parents an opportunity to ask additional questions if they had some, but the technical difficulties just got away from us, and so instead we're going to be watching this post recording. So let's go to our next question from a preschool family. If a parent has mild symptoms like a runny nose or sneezing, is the child required to stay home also if they have no symptoms?
So for adults, when we get a runny nose and we don't have another reason for it, now if we know as an adult it's very similar, it's the same as the same allergy symptoms we usually get at this time of year, there's another reason for it, then that is fine. The whole family can continue on. But if this is the new thing that doesn't fit with another diagnosis, then adults do need to be tested when they have those kinds of respiratory symptoms, because it is possible that it's COVID, and we want to make sure we rule it out. For younger children, there's many more causes we see of runny noses, but adults aren't as likely to pick up the viruses like that, the different respiratory viruses. And so there is a different screening tool for adults and children. They're both on our website. So again, Ottawa Public Health, we have those screening tools for adults and children. And when an adult has a symptom like that, it needs to go for COVID testing, we do say the whole household needs to stay home until it's determined that it's not COVID. So when a negative test comes back, everybody can go back about their business. If the person with symptoms, it's resolving, they're able to go back, when they're feeling better. But the rest of the household can go back to activities right away.
And that is certainly what's happening in our childcare programs, both from home and group, where we're being quite strict and parents are being very responsive and respectful and staying home if they have any signs of illness. So our next question is from a toddler parent. She's wondering, what is our recommendation to pregnant mothers who are expecting to deliver in the coming months and who have children currently in childcare?
Yes, this one's hard for me to make a decision for all pregnant women because people have different circumstances. So the kinds of things, we would recommend people consider are their own health status. So for the woman who's pregnant, does she have any underlying medical conditions? Is there anyone else in the home that they're worried about who might be more vulnerable to more severe illness? We actually don't have a lot of evidence about COVID in pregnant women, but so far we're not seeing that pregnant women are more likely to be infected with COVID or have more severe illness. So we'll continue to look at what's emerging. We do know it's good to avoid getting fevers in pregnancy, and the balance with what families need to be able to go about their lives is important. So are there any other options for childcare, or how much do people need to be at work, or can they adapt their work to be able to work from home? So there are a lot of different variables to balance. For each family, it's going to be a different decision. But I think, it is fair to say I would recommend limiting your close contacts if you're pregnant. So limiting visitors to the home, making sure that if you're visiting with others, it's with 2 meters distance, ideally outdoors, those kinds of basic messages, which we actually recommend for the whole population right now. Those things do protect. If you're wearing a mask and 2 meters distance from others, you're unlikely to pick up the virus.
That's very helpful. Thank you. And here's another compliment from one of the parents who responded. They say, I recognize how hard it has been to stay positive during this pandemic. I've been impressed with the way in which you've not gotten frustrated by others who constantly question public health directives. So well done.
Well, I can understand why some people get frustrated with public health, with the constant need to adapt, and the COVID pandemic changes, and then our advice has to change. And so, I appreciate people sticking with us and recognizing we're all trying to protect each other. And we're here, our role is to provide the best information we can to make, it easier for you to make informed decisions. And really, it's been impressive how people have done what needed to be done, you know, and turned the curve, working on that again, you know, so, but I'll pass on the thank you to the team.
Great. So this toddler parent expresses a concern that the public health protocols for COVID, such as the strict social distancing, will have an effect on children's development and their well-being. So they're asking, what is your position on strict social distancing in the home and childcare setting?
Well, this is hard. This is a hard time. Normally, children are around a lot of other children as part of their normal development. I know that children are resilient, so the development that they need to do, you know, is flexible. Children are likely to come through this, you know, and come out the other side of the pandemic, you know, as you know, not significantly harmed, but you know, parents know their children best, and if parents are seeing signs of anxiety or other trouble with children, you know, taking less interest in things, you know, there are people that you can talk to about your child development. Ottawa Public Health has some resources on our website related to mental health for parents and children. Some of the services are available online either same day or next day. So certainly check that out. But I do have a lot of confidence in the resiliency of children. And I think that we know children need stability and an adult who cares for them. And that's their foundation. And so while they may not be able to socialize to the same degree with others, that foundational relationship with a caregiver is really most important. And then we know, and we're talking today about child care settings, you know, it is impossible to make every situation perfectly safe, and we want to normalize children's lives. So we do accept in childcare settings that children will be closer than 2 meters. Sometimes children will be, you know, close to other children, and that's why we're working so hard to keep the level low in the community, to keep it out of childcare, because we want to prioritize children's development, and that's part of it is in the childcare setting as well as at home.
I really appreciate you saying that and clarifying that, because what we've been relying on is the strict screening, the parents having remaining at home when they or their child, anyone in the home, has symptoms as part of our COVID safe protocols, knowing that children will be playing together and they will be engaged. We have lots of strategies to support time for them to also be physically distanced, particularly like in eating and sleeping. But when they're playing, we don't want to be interrupting and interfering with that play to a point that's detrimental, which does fit with actually the next question that a parent is asked. So the parent is really concerned, you know, about these measures to protect us. How detrimental are they going to be? And so wondering what do you think are the long-term effects this will cause to children? You answered part of this already, but I think another explanation. And will they grow up feeling anxious whenever they are within 2 meters of another person?
Yeah, I know that I mentioned earlier, children are resilient. You know, we saw some of that, I think, in the summertime when things weren't as restricted. So we went through the first wave where everyone is home, and then we went into some months where it was easier. People were able to meet up, and you know, I think that children right away, it appeared, you know, went right back to socializing. And so, you know, I think this, again, now we're in a difficult period where we need to decrease COVID transmission in the community, so there's more isolation again. But I do think that children will come through this, you know, and adapt. And if there are warning signs, if a child doesn't seem, again, to be themselves, then that's worth talking to somebody about. You know, I don't want to pretend that the learning how to wash your hands properly, is a good trade-off for the other things that we are legitimately, wanting to be able to help our children with their social development, their language development. Those are important. And so I think what you had mentioned earlier is useful. If early childhood educators have more tips and tools they can share with parents to be doing more at home, that may help in the situation.
That's great, thank you. Then our next question is from a parent who has said that their child has been required to get 3 COVID tests in the last 4 weeks, and they've missed a whole month of childcare, which is a concern for sure. And it was mostly due to a runny nose. Some of these questions probably arrived to us just before the symptom list had changed. So they're asking if my child only has a runny nose, which maybe would take a few days to develop, and therefore would not be improving in the first 24 hours, what exactly should I be doing? Can my child return to childcare while they still have a runny nose if it is improving, and would a COVID test be required? Oh, I think I've mixed up the questions. My apologies. Sorry. Maybe we'll just go right to yes. Thank you. There it is. There's the question.
We can go backwards too. That's fine with me. But this one about the runny nose is, again, it's the screening tool, which says if a child only has a runny nose, you want to stay at home for 24 hours. Make sure it's not getting worse. If there's something else that appears, then it's the COVID test. If a child is improving and they feel well enough to go back to childcare, then this is what we're accepting. I think that message is on our website that if the symptoms are improving, the child feels well enough to go. It's just that one symptom, then that's acceptable.
Thank you. So let's go back to the 6th question, and the one that I missed. So this parent is talking about how our educators are now wearing masks and eye protection and gloves and gowns and any combination of all of the above. And they're worried about how this will affect children's learning and their ability to read facial expressions and respond. Thoughts on that?
Yes, well, we've been interested in this for sure. Language development is very important, and we've been following the desire to have clear masks, for instance, that could help children see lips and more body language. But the challenge is we just don't have a lot of evidence yet that these clear masks are as effective as something that filters the breath. It does seem that they have less ability to be a barrier because the breath can go out and around the plastic kinds of mouth shields, those kinds of things. So they're not all. We don't have one that's recommended by public health at this point. I think it goes back again to the importance of doing some language development work, talking to children at home where there isn't that kind of barrier, and looking to our childcare providers to provide supports to parents to do that, and knowing that the children are resilient, they can catch up, and we expect that will work. I think some of the other things that haven't been brought up today so far, maybe they're going to come up. I'll just wait and see if there's other questions. That I was just going to talk about the challenges to children's development if families are losing their employment, or families that have a business where they've invested their life savings, and these kinds of stressors, those can be significant in a family. So again, I just want people to know that there are supports there. We do always encourage people to reach out. The city has emergency financial services and aid. Those kinds of stressors can have impacts on children too, and so just to note that this is not an easy time for many people.
very much appreciate that acknowledgement for sure. And that sort of leads me directly to what one parent had written, which is a plea basically for all of us to be really paying attention and being as COVID safe as possible so that our childcare programs and our schools do not have to close. So what she says is he says is, my concern is that in the event that daycares close again, my child will be missing out on crucial development, i.e. social skills. As a full-time working parent of more than one child, my quality of care cannot possibly compare to that of trained professionals in a childcare center. And so we appreciate that acknowledgement. And yes, all of us then have a responsibility, even if we don't have young children, to be doing our part to be COVID safe. So here's a really practical question. So if a childcare program is cohorting classrooms in order to effectively prevent spread, why are entire childcare programs closed for 14 days minimum when there has been one positive test?
Yes, well, it's not always the case. We actually, every time somebody tests positive and is linked to a childcare setting, every time we assess that situation anew in terms of who were the close contacts. So we talk to the childcare providers in the center. We reach out to the parents of the child who tested positive. We look at who was in close contact when that child was infectious. And sometimes it is just a cohort, and actually we can just ask the other children in that cohort to stay home, or the childcare providers. But at other times, there's reasons why we can't stick to the cohort. Like maybe one childcare provider had to come in to help out for a time, or there's different flow of children, or happened, or mixing of cohorts, or we couldn't be sure. Sometimes things are done on a precautionary basis. And sometimes the child care center decides to close on their own. And so it's not always a public health reason or direction to close. So just to go back to, we really do try to use the cohorts. That's the purpose of the cohort, is to limit the number of people who are impacted when someone does test positive. And yet I know it's hard for childcare centers to maintain cohorts sometimes, given pressures on staffing and other things. And sometimes, I guess, there's just, each situation's different. There could be siblings in different classes, different things happening. So again, we'll walk through it with each situation.
Great. And then there's sort of two additional sort of sub-questions that link with this one. One was it would be very helpful to understand the differences or the percentages of COVID cases between childcare programs and schools. And then also, without breaching confidentiality, is OPH able to provide more details about specifically when and where childcare outbreaks are?
Yes, I think this information is available. I'll just start there to say, actually, detailed information about the number of outbreaks in childcare centers and the number of outbreaks in schools, whether elementary or secondary or post-secondary, is all on our website. Ottawa Public Health has a dashboard that we update daily. And it also lists the names of the childcare centers and the number of people who've tested positive in the center, whether staff or child. And it talks about the date the outbreak started and then when it would end. And so the other part of that question, relates to how outbreaks are counted, and there are more outbreaks in childcare centers right now compared to schools, but schools have a different outbreak definition. So in a childcare center, is one person testing positive. I think the intention was it was emergency childcare centers that were open first, and they were following the long-term care home approach, where again, it's a vulnerable population. You want to make sure that everyone's protected, that transmission is shut down as soon as possible. So one positive is considered an outbreak in long-term care as well. And then there's been feedback that this is causing challenge between childcare and schools, that it's different because in schools it's 2 people test positive with a link between them within the 14 days. So I know this is under active review by the province, crosses different ministries, but they're looking to harmonize that outbreak definition between childcare and elementary.
Great, thank you. The next question is kind of fun, where the question is, can OPH revise the required questionnaire where they're being asked, or parents are being asked every morning, have you been outside of Canada in the last 24 hours? Because they find it's a bit redundant.
Yes, and I find that too when I do the screening tool online, like, no, I haven't left Canada. No, nobody I live with left Canada. But it is a requirement, of the federal government under the Quarantine Act that if someone has left Canada, then they need to quarantine. So it's there in the tool as a requirement. I think, there may be ways that different centers could look at streamlining. We still need to ask it. If people could have gone across the border, I suppose, but it's not something public health can change.
And it's interesting because as much as the question does seem redundant, it has happened to us a couple of times where people have said, oh, wait a minute, I did have somebody come and visit. And so we found actually it's important to ask the questions in a different order so that people actually have to pause and think about them, because sometimes you just get so used to saying no, and then you have to shake it up a little bit, and that has helped actually parents to be thinking about the questions a little bit more detail, and there might actually be something that does connect. There's a reason for them to be.
Thank you, and thank you for being active about asking the questions. I'm saying to the sector, because it is the first defense is to make sure that people stay home when they could be a source of risk to others, and actively examining that every day is very much appreciated.
So our next question is about use of disinfectants and chemicals that we're using in childcare programs. The question is wondering, even given the limited ventilation in colder months, they're afraid that this might have an impact, actually, just this active use of chemicals and disinfectants. And then somebody else asked, doesn't seem like the HVAC regulations are applicable to childcare programs. Is that something that maybe should be addressed?
Well, we first of all do have recommendations for cleaning and disinfection on our website, and we do want people to be using approved products according to the manufacturer's instructions. So more is not always better. And when it comes to ventilation, we do encourage checking the operation of the HVAC systems, making sure they're functioning well. Opening the windows when it's possible, increasing ventilation. We don't have, there isn't a lot of evidence that HVAC systems themselves are a source of transmission of COVID, but ventilation is useful. More air exchanges, could possibly decrease the likelihood of transmission of the virus if it's introduced. But the main way that this virus is transmitted is through respiratory droplets. And droplets are heavy. When they leave your mouth or your nose, they fall usually within 1 meter to 2 meters. And that's why we talk about the distancing and why we recommend masks, because that is what will keep those respiratory secretions from reaching another person.
That's great. That's very helpful. And so one of our parents commented, please ensure schools and childcare programs get the same level of thought and planning at the same time. That's just a little request that was posted.
I did want to say that schools got more dedicated funding for school nurses, came to us to set up that new program. But we are expanding how much information is available specifically in a format, dedicated website for childcare. So if that's not up by the time you post this video, hopefully it's up within the week. we do have teams dedicated to childcare to assist with infection prevention and control measures. When there's someone who tests positive, to provide advice around what needs to happen, to provide information about the cleaning or the disinfection, to support even centers around drafting letters to families and advising about when people can return. So we are there to answer questions from childcare providers. They go to children's services. They come to us as well. So please don't hesitate to reach out. Even I think, unfortunately, because we had technical problems, I'm not going to get maybe so many more questions from you tonight, but you can always send them to Ottawa Public Health, and we will answer questions from childcare providers, from parents related to childcare. And so the new resource will be a childcare website with frequently asked questions, funnily enough. So some of your questions might show up on our website. And really, we continuously adapt our communications and our tools to try to support the sector.
Thank you very much. Appreciate that. And definitely, as we are leaning on Ottawa Public Health and the Children's Services team at the City of Ottawa, we invite you to lean on us as well, because as agencies that are providing early learning childcare in group and in homes, we have lots of experience to share as well. So we were quite happy to also perhaps be your conduit for information, or if you have a question, if something's going to be practical, is it something that actually is going to support children and families? If there's any way that something can be adapted so that it's just as COVID safe as possible, but still works really effectively for children and families, we would be happy to contribute to those conversations as well. And I'm speaking on behalf of the whole sector when I say that. So here's our next question. So a parent has said that at the center they're attending, the center's been sending home indoor shoes and water bottles every day. And the parent feels that this is a little counterintuitive, because it means that every day there's a risk that children would be bringing germs to and from home to center. Just a comment on that. What do you think? Is that something that we should practice that should be changed if it's happening at some centers?
Well, I'm not an expert in running child care centers, so there may be a reason for the shoes to go back and forth. I'm not sure. If it can be avoided, it's probably good to avoid things going back and forth between the homes. I appreciate, I understand the water bottle. If people want to make sure that's cleaned every day, that you wash your water bottle at home every day. That's kind of like the lunchbox going back and forth. I think that's reasonable. The main thing, of course, is after touching something that comes from a childcare setting or coming from a home, is to wash your hands. The hand washing is the main way that things are transferred from things to people. It's through our hands. So if we keep our hands clean, and that is, also that's the most effective way to avoid transmitting the virus.
Great. Okay. So this parent says that there are some nursing homes that are testing their staff every 14 days. And they're wondering why this isn't something that's in place for childcare programs and even maybe for schools.
I can't definitively answer this for the province because it's a provincial program of this what we call surveillance testing every 14 days in long-term care homes. But I can tell you, the context is that we saw terrible outcomes in long-term care homes in the first wave. Unfortunately, we saw the virus spread very quickly, undetected, and again, people have asymptomatic infections where they can be infectious to others, and we saw the worst kinds of outcomes with people hospitalized and dying, and so that it's a very vulnerable population. The province is aiming to prevent that from happening again, and with the surveillance testing, the Ministry of Education is in charge of the policies and the guidelines for childcare, and they haven't seen the same kinds of negative outcomes in childcare settings, and that may be related to their policy approach, not to go into the screening of asymptomatic people.
Excellent. You mentioned at the beginning in your opening remarks, how important we all became aware of how important childcare is to children and families when all of a sudden it wasn't available. So here's a couple of compliments that parents had posted specifically for their childcare programs. So one parent says, "My daycare is working so hard to keep its staff and children safe. We appreciate them so much." And another one says, "I really, really appreciate how the staff at our center wear PPE and visors. I also appreciate how they've been patient with answering questions and helping us find some comfort sending our child there." So I wanted to pass on that we know we're in partnership with children and families, and the families are clearly also appreciating what the programs have been able to do in order for children to be as COVID safe as possible while in care. Another parent says that some employers are not as flexible as they should be. The requirement or expectation for many is that parents work from home when their children are ill and cannot attend care. This is using up vacation leave for many parents, as it is not feasible to work full-time from home with an ill child or infant. I can't imagine. So you did mention already that we're very sensitive to how much pressure parents are under as they're trying to manage work and family responsibilities, which already were a pretty heavy load for young families before COVID, and now with COVID, it's extremely heavy. So hopefully,
I do in my messaging ask businesses to be more flexible and to enable people to stay home when they need to stay home and not expect the same kinds of work. I think this is a societal question of how can we better support parents into the future. I'm a little off topic now, but I think we should use this opportunity of learning how important childcare is, and then what kind of supports parents need to develop the right kinds of policies and approaches into the future. There's not much more important than early childhood development for the child's health and the trajectory for the rest of their lives. And parents are, and early childhood educators are doing some of the most important work for our population. So anyway, that's a bit of opinion now, but I think, an encouragement, if these things are emerging and need to be addressed, then we should look at that as a society.
Very much appreciate what you just said, and for sure, COVID has been an experience that none of us ever expected to have, and hopefully there can at least be some benefits. Hopefully we have lots of lessons learned that we can consider for our new normal, our future normal. So this next question is very interesting. As the numbers of COVID-19 cases in Ottawa increase, will the numbers be allowed in each cohort of childcare classrooms would be reduced, perhaps reverting to the previous numbers allowed?
I don't know if that is something that the province would direct or establish as the next step. The class size, the cohorts, these are again set by the province. My interest is in keeping childcare and schools open as long as possible, and if that kind of measure could help, that is something we could look at discussions, if it came to that with the province. But it's hard to say. If we all do our part and we prioritize getting the transmission in community settings down, we'll be able to carry on with the childcare approach that we have.
That's great. And then the sub part of this question is you've already answered, I would suspect. So we're going to go on to question number 14. At what point do case counts in the community get so high that it is no longer safe to keep childcare programs open? And then an infant parent asked, at what point will you deem the risk to children and employees enough to close childcare programs?
I can't give you one number of how many infections per day, at what threshold, things would need to change. I can tell you what we're looking at is many different factors. The first goal is to prevent hospitalizations and death. So if we're seeing hospitalizations rise and more people dying, that is a concern that the level of COVID in the community is too high. Our hospitals have more capacity. They are in a good position with ICU beds. They're full right now of people not severely ill in intensive care unit, but they're trying to catch up on surgeries and lots of other important work, and they're having trouble with people being able to be discharged to long-term care because there's less capacity in long-term care right now. So all to say, hospitalizations matter, and even just the pressure on hospitals. But we're also looking at, what is the trend? Where are the exposures coming from? And what are the age groups affected? If they're younger age groups, it's not as likely to lead to hospitalizations. If we can localize what's driving some of the transmission, if it's a particular type of setting, then we can be more targeted in the measures, and that's what we're aiming for, is to be able to really address the risk where it is, and then keep people employed, keep people in childcare and school. I can tell you the risk is always where people are in close contact and they're not wearing masks. So it's more that behavior, even more than the settings. If people are gathering with others without 2 meters distance and they're not wearing masks, that's really the root of transmission.
So the next question, I think you have answered a little bit already, but it does definitely bear repeating, because it was a question that came specifically from a parent. So they're looking for additional resources because they are concerned about their child's mental health and because of things they are saying.
Well, thank you for bringing this forward. I think that it is important to trust parents. Again, they know their children best. You'll know if something doesn't seem right. And so, as I said, Ottawa Public Health has a website with mental health resources for parents, for children, for youth. There are different services, and many of them have adapted during this pandemic to be online or by phone. And then also there are some that are available very rapidly, either same day or next day. So don't hesitate to reach out. This is a difficult time. There's no question. When we did surveys of the population and how people are coping, we found parents with young children are reporting the highest levels of distress. So you're not alone in feeling distressed. There's no shame in that, and there are supports available for you. And childcare is one of those supports that we definitely want to keep there in place. And I want to thank everyone again so much for what you're doing, how you're adapting. And there will be an end to this. We will get through this. And we want to focus on, until then, what can we do to support each other? Parents supporting parents virtually, reaching out to friends by text, checking in, making sure that we all stay physically active too. We need to get out of the house and do physical activity. Outdoors is ideal. These kinds of things actually do help us cope and get through.
That's good, thank you. So we have a parent who's asked actually for you, if you wouldn't mind, Dr. Etches, to give a message to the general public. And so what they say is a general message reminding people which side of the street they should walk on to facilitate physical distancing. So they say the Highway Traffic Act specifies that pedestrians should walk facing oncoming traffic. I thought this was a well-known fact, but walking in this pandemic has been nothing but frustrating. With a baby stroller, I'm much less maneuverable than other pedestrians. Much appreciated. So,
okay, that's good feedback. Thanks. Yes. Okay.
And then also, another parent wrote, phenomenal job keeping the majority of public safety and interest at the focus of daily evaluations. Just remember though, the best decision, all factors considered, will not satisfy everyone's beliefs. Public safety is paramount, and OPH is proving that they will not back down from the pressures of the masses. Thank you. So that was another compliment from a parent who wrote in. We were coming to the end of our hour. Before I ask you just if you had any final words, I'd like to just acknowledge that tomorrow happens to be ECE Appreciation Day, so Early Child Education Appreciation Day. It's an annual day, the same day in October every year. This year it feels particularly more important to acknowledge appreciation, not just for early child educators, but everybody who works alongside them, to make sure that we can keep children as safe as possible while children continue to be able to learn through play. So final words to you, Dr. Etches, before we say goodbye.
I think I've said it a few times, but it makes a difference what individuals are doing. And so nobody's perfect, but when you limit your close contacts to your household, and you wear a mask when you're out, and you stay home when you're sick, and you screen your children before they go to childcare settings and keep them home if they are sick, those things add up, and they make a difference. And we can see it in the infection in our community can come down from where it's too high at the moment, and we can turn that curve again, and yet that's not easy, right? And so I've heard the concerns about childhood development. I do have a lot of confidence in the resiliency of children, but it's parents that are stressed and challenged in different ways through this too. And so I thank you to the childcare providers who are helping in all of these ways, children and parents. And again, thank you for giving me the chance tonight to hear the questions, and we'll add them to our new website for childcare settings.
Thank you. And your time, it's very much appreciated. We know that you have very full days, very full evenings. You have your own young children and to take care of as well. So we appreciate you spending this time with us, and very, very valuable. So thank you.
Thanks.